Hi, welcome to Healthy Living. We are again on location in St. Tammany Parish Hospital, and we're still in Heart Month, so we're talking about all things heart. So today, heart health. So today with me, I have Andrea Vance. She is an echo tech for St. Tammany Health System, and we're going to talk about a little something special that we offer to the younger pediatric population for their heart health. So thank you so much for joining us. So before we start talking about what we offer, we're going to talk about that, we're going to get to the details of that, but just tell us a little bit about yourself first.
Well, I'm from South Louisiana. I've moved to the North Shore about 10 years ago. I went to ultrasound school in South Florida. I've been in ultrasound for 10, 11 years, and 9 of those years have been focused on cardiac.
Okay, so as an echo tech, which is your designation, right? What do you do? What's your day-to-day?
I get to look at hearts all day.
You look at hearts all day. So is it painful what you do?
No, I don't think, well, it can be depending on the patient and their pain level. But no, ultimately it's not painful. Again, it's patient.
It depends on the patient.
It depends on the patient.
Right,
yes.
right. So we want to talk about Heart Month and cardiac health, and you are, that's one of the things you specialize in. So we have something that we call the Living for Burke screening, and that was facilitated by a local family here who lost their nephew after a basketball game to sudden cardiac arrest. He was a teenager.
Correct, 14.
So yeah, so they raised awareness about this sudden cardiac arrest in teens, and his name was Burke, and so it's called Living for Burke. And we partnered with the Living for Burke Foundation, and we do these screenings. So tell us a little bit about that. What is the Living for Burke screening?
Well, we do 3 different things for pediatric patients. We do 12 to 18. We take their blood pressures to see if their blood pressure is elevated. We do an EKG, which looks at rhythm and rate. And then we do an echocardiogram, which is for structure and the overall function of the heart muscle.
Okay, and that's very important for all children, but specifically for teenage athletes where it seems to be, where sudden cardiac arrest seems to be a problem.
Correct, especially athletic kids.
Yeah.
So it's a good screening, baseline screening for parents that are concerned, especially if they have family history.
So while this may not necessarily prevent like sudden cardiac arrest, you can signal that there may be an issue, and we do with the Living for Burke screening. You do have a cardiologist who reads those tests and can give you some insight into what's going on, if anything at all, right?
Correct. We have a cardiologist that reads the EKG, and we have another cardiologist that reads the echocardiogram. So we have 2 of them. If something were to be caught, the parents would be notified, and they would be referred to a pediatric cardiologist.
Okay. So you don't need to go to your doctor and say, can you please refer me for this Living for Burke screening, right? You just walk in, you tell us that, and then how does that work?
So they can just call the outpatient pavilion or scheduling, and they can say that they're interested in getting a Living for Burke for their child. They're going to make sure that it's in the age bracket that we do. Right. And they just schedule it. Okay. And does insurance cover this? How does that work? No, you don't want to go through insurance because it is a flat rate for all 3 tests. Okay. So it's a pretty decent deal, I guess you can say. So the parent just pays the flat rate when they get to the clinic to check in, and we go from there.
Okay, and what is the rate?
$150.
Now, if you did all those tests separately, like you said, those are expensive tests.
Correct.
State-of-the-art equipment.
Correct.
So, yeah.
And it would probably cost a little bit more.
Sure. So why would I do this as a parent? Like, what's the benefit to me?
I think if, like I said, if you're having concerns or if there's a family history there, it's a good baseline. It's non-invasive. It doesn't hurt. So it's good to just get an idea of where your child is health-wise if they're really active, in my opinion. And it gives you kind of the baseline of where their heart health stands. And actually, this can carry into their adult life. Correct. When they start to see their primary care. Correct. So, well, it's a baseline for them. So say they're 17 and we just did a baseline. Say they have issues when they're 27. You can kind of compare, possibly. You have a good comparison. Okay, so let's talk about each of the separate tests you do. You talked about the blood pressure. Talk about the echocardiogram. What is that exactly? So it's an ultrasound of the heart, and it's Pretty detailed. We do a lot of measuring. We measure the chambers, the velocities between the blood flow, between the valves, and we just make sure everything is within the normal parameters of the patient's body size.
Okay.
So we do get height and weight, and then all the measurements coincide with height and weight to let you know if everything is as it should be.
Okay. And then an EKG.
EKG, you're essentially looking for rhythm and rate to make sure everything is good for the patient, of the age of the patient, I guess you can say.
Gotcha. So if you do find something like you said, what's the process that you guys go through?
So if we process it the same way. It's going to go to the cardiologist. It'll be the cardiologist that will contact, the cardiologist's office will contact the family and refer them to a pediatric cardiologist.
Okay.
And then the family would take it from there.
All right. So in your experience, what kind of warning signs, if any, are there for cardiac arrest for teens?
So unfortunately, the main sign is death. But if a child is fainting, having syncopal episodes, chest pressure, really fatigued with running, say they play a basketball player or something like that, you kind of want to get those things checked out.
Right.
That's just, chest pressure, headaches, things like that.
Okay. And then can we talk about real quick the importance of, if you do have a student athlete, hydration, especially in the South Louisiana weather. How does that impact the function of your heart?
It impacts it greatly. Dehydration is, I don't think people understand how much water they really need to drink, especially when you're playing sports.
Right.
I have a 12-year-old, and I have to tell him, you're sweating all your water out. You have to keep replenishing it. So I don't think kids understand that, and the parents are not there to make them drink the water. So when I do a pediatric patient, whether it's living for Burke or not, I always emphasize to the child, you need to drink more water.
Right. And how does that affect your heart? Like why does your heart need water, I guess is the question.
Well, if you don't drink water, it's going to have to pump a lot harder. The water,
you're stressing
your
heart
body
out.
is, 70% water?
Yeah.
So you're stressing it out.
Yeah, so we definitely want to emphasize that. That's some precautionary things you can do if your child isn't a student athlete.
Yes.
So is there anything else you want to add about the Living for Burke screening, about something that you do, about what parents should expect, anything like that?
Well, I think it's a good baseline to get your child. I'm probably going to do it for my own child this year. Just so you have a clear head. I know a lot of moms, my son plays travel baseball. A lot of baseball moms are always questioning symptoms that their child may have, and I just think it's a good non-invasive test to get your child.
Yeah.
So it gives you a peace of mind.
And it's something that we offer. It's very easy to schedule. It's very easy to get in here and do it. So, well, thank you so much. We appreciate you taking the time to come today. I know you have a busy day
Always
ahead of us and after us, so we appreciate it so much.
Thank you.
All right, thank you. Thank you so much for watching this episode of Healthy Living. We'll see you next time.